Hello, this is our 60-second update on the contraceptive implant, commonly known as Nexplanon. This is usually fitted subdermally. It's a small plastic rod and it tends to be fitted in the arm. It releases a single progesterone hormone, which makes it quite useful for ladies that are unable to take estrogen. Now, it's 99% effective, and if it's fitted during the first 5 days of the lady's menstrual cycle, then it offers immediate protection. The good thing about this is that it lasts for 3 years. It works by preventing ovulation and thickening of the cervical mucus. Now, typically, side effects might include irregular bleeding or amenorrhea, which is where periods stop completely, mood swings, possibly, and also acne. Contraindications to the contraceptive implant are breast cancer, ischemic heart disease or arterial disease, liver disease, and undiagnosed PV bleeding. Visit TrewLink.academy for further details about our courses.